Hi friends, good evening and welcome to my channel Mukambika Nursing. Friends, here we are discussing questions for RRB staff nurse exam preparation. Yesterday's video we discussed previous year questions and some important questions from fundamentals of nursing. Today's video is also the continuation of yesterday's question. We can see the questions. First question, which of the following chemical is the most powerful disinfectant? Options, option A Dettol, option B Lysol, option C Phenol, option D KMNO4. Question, which is the most powerful disinfectant? Answer is option C Phenol. Phenol is the most powerful disinfectant. Disinfectant means an agent which kill the pathogenic organism is known as disinfectant. Move on to the next question. Fresh bleaching powder contains options. Option A 0.033% chlorine, option B 33% chlorine, option C 0.33% chlorine, option D 3.33% chlorine. Question, the chlorine content in the fresh bleaching powder is? It is 33%. Option B is the correct answer. Chlorine is 33%. The next question, which of the following technique is appropriate for wound dressing? Options, option A medical asepsis, option B surgical asepsis, option C septic technique, option D A and B. Our question is, which technique is used in wound dressing? Wound dressing will always do in a sterile technique. Okay, so that means it helps to prevent the entry of both pathogenic and non-pathogenic organism into the body. Sterile technique is also known as surgical asepsis. Okay, wound dressing, the technique appropriate for wound dressing is surgical asepsis or sterile technique. The next question, solution used in suction bottles before suctioning with disinfection purposes. Option A sodium hypochlorite, option B Savlon, option C Dettol, option C Lysol. The question, for disinfecting purpose, which solution is used in the suction bottle? And the correct answer is option A sodium hypochlorite. And the next question, fiber optic items are sterilized by? Options, option A 0.5% chlorine, option B 2% glutaraldehyde, option C 50 to 70% alcohol, option D Savlon. Fiber optic items are sterilized by 2% glutaraldehyde. Option B is the correct answer. The next question, solutions used for disinfecting enamelware is? Option A 0.5% chlorine, option B 2% glutaraldehyde, option C 50 to 70% alcohol, option D Savlon. And the correct answer is option A 0.5% chlorine. Enamelwares, that is glass items, are sterilized by using 0.5% chlorine. The next question, disinfection of patient unit after death or discharge of the patient is known as? Option A concurrent disinfection, option B terminal disinfection, option C sterilization, option D quarantine. Our question, which type of disinfection is used after the death or discharge of the patient unit? Correct answer is option B, it is terminal disinfection. First option, concurrent disinfection. Concurrent disinfection means the immediate disinfection of all the contaminated articles during the course of disease. For example, cleaning the patient unit area or cleaning the isolation unit, proper disposal of waste, disinfection of soiled linen. Suppose if blood spills are present in the patient area, means that should be cleaned. That all coming under concurrent disinfection. And the next question, Sidex is also known as? Options: option A glutaraldehyde, option B formaldehyde, option C Cosalex, option D hypochlorite. The correct answer is it is glutaraldehyde. Option A is the correct answer. Cides is also known as glutaraldehyde. The next question, yellow plastic bag containing biomedical waste are treated by options. Option A microwaving, option B autoclaving, option C shredding, option D incineration. The biomedical waste in the yellow bag contain human tissues, amputated parts, placenta, infected dressing, cotton, bandages, disposable face masks, blood related all product, that is blood bag, everything we are keeping inside the yellow bag. This yellow bag with waste are treated by using incineration. Option D is the correct answer. The next question, cleaning of thermometer needs to be done in which direction after taking temperature? Option A bulb to stem, option B stem to bulb, option C midway between stem and bulb, option D midway between bulb to stem. Our question, after taking temperature, the thermometer should be cleaned from where to where? That is the question. So it should be cleaned from stem to bulb. That is from more clean area to less clean area. That is in after taking temperature. But before taking temperature, we have to clean the thermometer from bulb to stem. After taking, it is stem to bulb. Before taking, it should be cleaned from bulb to stem. The next question, the nurse in charge measures patient temperature at 102 degree Fahrenheit. What is the equivalent centigrade temperature? Options, option A 39 degree, option B 49 degree, option C 38.9 degree, option D 48.1 degree. Our question, the nurse in charge took the temperature in Fahrenheit. We have to convert it in centigrade. Okay. The formula is C is equal to F minus 32 into 5 by 9. Here Fahrenheit temperature is 102 degree Fahrenheit. So C is equal to 102 minus 32 into 5 by 9. 102 minus 32 means it is 70 into 5 by 9, 38.88. So we will write it as 38.9 degree is the correct answer. The next question, type of fever in which the temperature fluctuates more than 2 degrees Celsius or above normal during a 24 hours of period is called. Options, option A intermittent fever, option B remittent fever, option C relapsing fever, option D recurrent fever. Here the temperature fluctuation is more than 2 degrees Celsius. So the correct answer is it is remittent fever. Option B is the correct answer. In remittent fever, the temperature variation is more than 2 degree between morning and evening, but it does not reach as normal. Okay, that is known as remittent fever. Here, temperature fluctuation is more than 2 degrees Celsius. So that indicate it is a remittent fever. And the next question, if a patient blood pressure is 160 by 96 mmHg, his pulse pressure is options, option A 64 mmHg, option B 96 mmHg, option C 160 mmHg and option D 256 mmHg. Your question is pulse pressure. What is the pulse pressure if the patient blood pressure is 160 by 96? Pulse pressure is equal to systolic BP minus diastolic BP. Here systolic BP is 160, diastolic BP is 96. So difference between systolic BP and diastolic BP it is 64 mmHg. So the correct answer option A. The next question, gradual increase in rate and depth of respiration is known as option A hyperventilation, option B hypoventilation, option C Kusumal respiration and option D Kine-Stokes respiration. Question. Gradual increase in day rate and depth of respiration is known as Kusumal type of respiration. Option C is the correct answer. This Kusumal respiration is mostly associated with metabolic acidosis, especially in case of diabetic ketoacidosis. Okay, Kusumal type of respiration we can see in a disease condition, diabetic ketoacidosis. The next question, if a narrow cuff is used to measure the BP, what will be the outcome? Option A, actual reading will be obtained. Option B, falsely high reading will be obtained. Option C, falsely low reading will be obtained. Option D, BP can't measure. Question, if we are using narrow cuff to measure BP, then what reading we can get? Okay, that is the question. So, we will get falsely high reading. Okay, option B is the correct answer. If we are using narrow cuff BP apparatus means we will get falsely high reading. Suppose if we are using large cuff apparatus for measuring BP means we will get low BP, low reading. Okay. Move on to the next question. Location of auscultation of apical pulses. Options. Option A, fifth intercostal space at the right mid-axillary line. Option B, fifth intercostal space at the left mid-clavicular line. Option C, fifth intercostal space at the left mid-axillary line. Option D, fifth intercostal space at the right mid-clavicular line. Location of apical auscultation of apical pulse is fifth intercostal space at the left mid-clavicular line. Option B is the correct answer. So far, we discussed the next set of questions from Fundamentals of Nursing. If it is useful for your studies, please share these questions to your friend circle and like my videos, subscribe my channel also.